My name is Yaakov Scheinfeld, and last year, on August 22nd, I buried my beloved daughter because of what gender transition treatment did to her. My daughter had been in counseling for depression since the age of 15, but had never said anything about gender dysphoria to her counselor. At age 17, her mother told me that she was transgender. She did suffer from rejection in school and was seeking affirmation. 5 of her friends announced they were transgender. When she said she was trans, she finally had her peers' acceptance, so she thought, and she had not previously experienced in high school, the acceptance. When my daughter went to college, she began taking testosterone. When I saw her at the college, she was very depressed. Actually, she was almost rejected for non-performance of her academic studies. A social worker presented a meeting with my daughter. Her name is Shannon Sonnet, MSW. She told me that my daughter was going to get double mastectomy. When I objected to her taking such a drastic step at such a young age, at that point, 19 or 18 and a half, the social worker told me I was a typical chauvinist male. I am a typical chauvinist male who doesn't love his child enough. She said this is what we are going to do and you need to just get on board. The social worker assured me that everything would be fine if I just loved my daughter. My daughter had a double mastectomy at age 19. Exactly when, I don't know, because she didn't speak to me for about 2 years. It wasn't my decision, it was her decision. At some point, finally, it was very painful to me that separation from my child, things were mended. I accepted her, and to the best that I could, because inside, I was in such dichotomy of feelings because I rejected this whole journey. I think it's against God, it's against biology, as we heard from Dr. Laidlaw.
Good morning. I'd like to thank State Surgeon General Joseph Ladapo for seeking Florida medical guidelines which prohibit medical doctors from prescribing puberty blockers and cross-sex hormones for children and from performing sex change surgeries on children. Dr. Ladapo correctly asserts that puberty blocker drugs and cross-sex hormones cause irreversible, lifelong injury to children such as loss of bone mass, blood clots, and lifelong sterility. Until the Florida legislature criminalizes medical doctors performing genital mutilation surgery on children, the Board of Medicine and Board of Osteopathic Medicine should adopt the recommendations of State Surgeon General Ladapo. It is an oxymoron to call sex change surgery for children, quote, gender-affirming care, end quote, as there is no care being provided, but instead only child abuse, which has been outlawed and criminalized in some states in America. What is happening is that social media such as TikTok promotes gender dysphoria, which leads to peer pressure among teenagers and preteens to succumb to the pressure to believe that they should try to become the opposite sex. In the extremely rare cases of gender dysphoria, the child invariably is experiencing depression, which will pass with time and perhaps treatment. The solution to this temporary depression in children is not irreversible side effects of puberty-blocking drugs and cross-sex hormones and life-altering irreversible sex change surgery. It is way past time for women and feminists to reject men's false assertion that men can become women by putting on a dress and makeup and take some hormones. When feminists succumb to the false demands of these transgender men who claim now to be women, the feminists are victims of what they say they are fighting against, which is patriarchal men dominating and controlling them, women. Transgender men dominating girls and women in high school sports, in college sports, public discourse, public policy, and every other aspect of society. Women should stand up against this attempt by transgender men to dominate women. University of Kentucky swimming champion Riley Gaines has been outspoken on television arguing against transgender men, such as Leah Thomas, being allowed to dominate women swimmers in the college swimming championships. Ms. Gaines spoke the truth when she said that womanhood is not a mental disorder suffered by men. That concludes my remarks. I'd just like to say that I agree with the board member in the front who says to leave the clinical studies out of this proposed rule. It seems to be complicating it greatly. And as the gentleman said, there's 49 other states where these studies can be done. And I think it would be better to leave that out. I appreciate it. It looks like you're going in the right direction. Please continue. Thank you.
I've seen the full range of mental illness in children, adolescents, and young adults. We all agree mental illness is destructive for the individual, the family, and for society. Many of the individuals that I've seen that are LGBTQ or transgender have significant levels of mental illness. And often this mental illness has not been satisfactorily addressed by counseling or psychotherapy. Is it not the best practice to address psychopathology with approved psychotherapy before instituting life-changing, unhealthy transition treatments? Gender identity disorder only came to my attention 5 or 6 years ago, but it's now diagnosed in the code book for mental illness, the DSM-5, as gender dysphoria. It appears that we're dealing with an unprecedented epidemic of mental illness in adolescent females. This demographic comprises the bulk of the 4,400% rise in new cases of gender dysphoria seen in the past few years. So I ask you physicians, for what other disease do we allow an adolescent patient to make his own diagnosis and then demand a preferred treatment? As the Board of Medicine, what ethical standards must be met when providing sex reassignment? What standards of care have been established for this treatment? Does the board supervise quality control and satisfactory outcomes for doctors and clinics offering these services? What is a satisfactory outcome? These are all questions that need to be asked when you decide the rules for transgender treatment. I think other countries and judicial systems are well ahead of the United States in making this determination. In the wake of the Bell versus Tavistock verdict, as you heard from Dr. Biggs, the NHS has reversed course in its transition treatment advice. Florida should take the lead from this decision. A summary review of transgender medical research concludes there's no support for medical intervention for gender-confused minors. Medical transition procedures do not reduce youth suicide. Childhood gender dysphoria usually dissipates by adulthood, and the dramatic increase in gender dysphoria in the recent past is likely driven by social factors. My recommendation to the Rules Committee is that cross-sex medical and surgical treatment should not be supported by organized medicine, the Board of Medicine, the legislature, or insurance companies.
My name is Robert Roper. I've been authorized to tell the story of a patient named CG, that's a pseudonym, who has been irreversibly harmed by medical transition as a minor. He says this: had a rule placing restrictions on gender transition treatments been in place in my state, then I would not have been placed on the fast track to medical and surgical interventions, and I would not, at age 21, be facing a lifetime of sterility and a mutilated body. Like many detransitioning young people, I was gender nonconforming child who was on the autism spectrum and suffered from depression and anxiety. At age 8, I did not like stereotypical boy stuff. Instead, I liked girl stuff and the ways girls behaved. Transgender websites told me I was a girl if I liked girl things. I began talking with trans-identifying people through phone apps. At age 14, I told my parents that I was trans and believed that I was a girl trapped in a boy's body. My parents celebrated my trans identity and took me to see gender-affirming therapists. The therapist immediately affirmed my trans identity without any psychological testing or exploring why I believed I was trans. I then saw an endocrinologist in a gender clinic at Providence Hospital. The endocrinologist prescribed estradiol and spironolactone. At age 15, I began the hormone regimen. I experienced significant psychological complications from the treatments. I became depressed to the point that I was not getting out of bed. I became too anxious to go anywhere or talk to people and ended up dropping out of school. I also developed an eating disorder and an addiction to the internet. I was not functioning healthfully, but my parent continued to move me along the gender-affirming path, scheduling surgery at age 17. Soon after turning 18, I was flown to Washington, D.C., where my testicles and penis were removed. I was given a angioplasty to create an artificial vagina and received plastic surgery on my face. At no point was I offered any alternatives to medication and surgery. No one attempted to explore my underlying reasons for my depression and discomfort with my sex. I soon realized that treatments had not improved my life, and I discontinued them at age 18. Now, at 21, I have a body that is completely ruined. I have worried that my body is now going to be a freak no matter what I do. Even with parental consent, these treatments are putting kids on a path of harm. I was not able to grow up in a healthy way as a result of having been scarred by these treatments. I do not want to see other young people harmed in this way. I believe these treatments should be disallowed or seriously restricted for children and young people like myself. Thank you.
My name is January Littlejohn. I am a Florida mother of 3 children and a licensed mental health professional. I'm here to offer my personal experience, not as a counselor, but as a mom. In the spring of 2020, our 13-year-old daughter told us she was experiencing distress over her sex and she didn't feel like a girl. She had expressed no previous signs of gender confusion, and her announcement came shortly after 3 of her friends at school also claimed transgender identities. Soon afterwards, her mental health spiraled. We worked with a licensed mental health professional to help our daughter explore and resolve co-occurring issues, including low self-esteem and anxiety. We also gave her more one-on-one time, in-person activities away from trans influencers, limited her internet use, and declined to affirm her newly chosen name and pronouns. We set appropriate boundaries and allowed her to choose her hair and clothing, but denied harmful requests such as breast binders, puberty blockers, cross-sex hormones, and surgeries. It was clear from conversations that our daughter was uncomfortable with her developing body and had an intense fear of being sexualized. She was filled with deep self-loathing and was in true emotional pain, but had been encouraged by peers and influencers to believe that gender identity was the source of that pain. What she really needed was for us to help her make sense of her confusion and remind her that hormones and surgeries could never, ever change her sex or resolve her underlying mental health issues. I shudder to think what could have happened if we had affirmed her false identity and consented to medical treatments as opposed to what we did through watchful waiting, which was to lovingly affirm her as she is, beautifully unique and irreplaceable and undeniably female. After several years, our daughter has desisted and is on a path to self-love. I have spoken to many parents in Florida, and they are not being informed of all treatment options when they seek help for their child. Many times they are being convinced by medical professionals that affirmation and medicalization is their only option to avoid the impending suicide of their child. Suicide is told to these parents as if it is a guaranteed outcome versus a risk factor for these kids. Unfortunately, gender dysphoric children are being encouraged through activism and peer pressure to disassociate from their bodies and to believe their body parts can simply be removed, modified, or replaced. The irreversible consequences of medical transitioning, including loss of sexual and reproductive function, cannot be fully understood by children or teens who lack the necessary cognitive maturity or experience. These children deserve ethical, evidence-based treatment that helps them explore and resolve the true source of their distress. Please stop enabling doctors to chemically castrate and cut off the healthy organs of children and teens. Thank you.
Members of the board, my name is Bob Framingham, and I've been personally impacted by the harms of gender-affirming care through watching my son transition My son was educated in Christian private schools from kindergarten to grade 8, was an average, well-behaved student. He played baseball in Little League, was pretty good. He expressed no confusion over sex during childhood or adolescence. However, he was socially awkward and did have mental health issues. Grades 9 through 12, he attended Sale Public School in Tallahassee. Sale is a very progressive art school, and this is where he was exposed to the false idea that he could have been born into the wrong body. He earned a brown belt in Taekwondo and is an Eagle Scout. At age 18, he could do 20 pull-ups with one hand. Now he can't lift 40 pounds because of his therapy in order to help him grow breasts. He was diagnosed with borderline personality and severe depression in 2023. His mental health issues began around age 14, shortly after he started at school. It was clear that he suffered from low esteem and self-hate. Tyler announced that he was transgender at age 22 and began transitioning for 6 years. This has not improved his quality of life or resolved his mental health issues. He dropped out of college, has no meaningful romantic relationships, and is now anorexic. Clearly, there's a disconnect between Tyler's brain and his body. He intends to alter his body, but I really think he needs to alter his mind. I'm deeply concerned that his mental health will further deteriorate once he comes to the realization that making irreversible changes to his body will not fix his pain. So I would urge you to create a rule that will protect children from making irreversible, life-changing decisions when their brains are not fully developed. I would encourage you to put safeguards in place, even for adults seeking transition, like counseling to address other mental issues that may be the root cause of the confusion prior to any surgery or hormonal intervention. And I would suggest that having a true informed consent where patients are fully informed of the consequences of taking hormones, including the rate of regret and the high risk of suicide 7 or 10 years after transition. Thank you very much.
Hi, my name is Patty Sullivan, and I'm with Parental Rights Florida. And just a quick caveat, since it was brought up, the American School Counselors Association, the American Medical Association, the American Pediatrics Association, this is why this board is needed to bring clear evidence-based rules and guidelines and standards. The past president of the American School Counselors Association in August in 2022 at a national conference basically said, here in Florida, we have these laws made, and you need to learn the rules so that you can break the rules. So this is why you all are needed, and your expertise is needed to bring these clear, evidence-based standards. I spent thousands of hours researching to understand why specific Florida-based and national advocacy groups consistently opposed common sense, family-friendly legislation in Florida. I am a Florida citizen. I'm a Florida mom. The research that I did, hours and hours, confirmed these non-medical organizations push gender-affirming medical interventions, even though real research shows the majority of these children will resolve distress after puberty. Many of these parents with gender dysphoric children are not being presented with this critical information, nor are they being given all the treatment options available to them to treat their child's gender dysphoria, such as watchful waiting and counseling. If what is being forced on these children and these families is so valiant, why are these groups, why were they hiding and lying and deceiving and putting these support guides behind the scenes and keeping parents out of the loop? I have a school psychologist on video telling administrators how not to tell the parents through my research. Why are these groups still pushing irreversible medical transition procedures on children when they know that the research shows that the rate of completed suicide increases to 19 times that of the normal population post-transition? Children with gender dysphoric issues deal with profound and complex emotional issues. I had issues that resolved from a childhood. And I'm married 34 years. The consequences to a child making permanent life-altering decisions, taking drugs that alter their moods and bodies, and then having their genitals and breasts mutilated is beyond comprehension. The Florida Medical Board can put clear, evidence-based rules, guidelines, and standards in place and bring clear consequences for those who would flagrantly break these rules and laws. And the time for courage is now. I commend you and I support you. Please do this and bring pause. Thank you.